Namaste. Now let us understand what is polycystic ovary. If we split the word polycystic, poly and cystic. Poly means multiple. More than one is called poly. And cystic means a cyst filled with water. When more than one cyst or underdeveloped eggs are accumulated inside the ovary, they look like polycystic in the sonography. This is how the name polycystic ovary is established. Now, in the normal course, the egg grows in 15 days and ruptures. But this does not happen in the case of polycystic ovary, and hence the menstrual cycle does not occur regularly. Since the creation of eggs is not happening regularly, it delays the periods, that is one aspect, and along with that, it obstructs pregnancy, which leads to infertility, that is the second issue. Most of the times, the polycystic ovary is hereditary. Just like diabetes or obesity, polycystic ovary is also hereditary. The patients with diabetes are more prone to having polycystic ovaries. And hence it is needed to keep your weight in control, have a regular exercise and a low carbohydrate diet. So these restrictions of a diabetic patient are also applicable to polycystic ovary patient. The treatments for polycystic ovary are of two types. If the patient doesn't want to conceive a pregnancy, then she is given contraceptive pills to regulate her menstrual cycle. In some females, few other problems are observed with the irregular periods, such as having pimples on the face or having extra hair growth over the lips, which is called as hirsutism. These problems are caused by hormonal imbalance and it can be controlled and managed by medication. Now, when the egg production is wanted, that is when the patient desires pregnancy, at that time we give medicines to produce the eggs. In the earlier stage, a small dose of medicines is given and it's examined whether the eggs are being produced or not by follicle study through sonography. In this treatment, the patient is always given a moderate dose because if more than 2 eggs are produced, say 6-7 instead of 3-4, the same number of embryos will be formed, which is dangerous to the patient's health or hazardous. Hence, after every small dose, it is examined that how many eggs are produced. And if it is less than the required number, then we increase the dose. So this is how we start with a low dose and increase it as needed. And if the medicines are not obtaining the results, then the patient is given injections for the same in a similar way. First low power and then high power injection. So when a patient gets the dose that is suitable to her particular case, that stimulates the production of eggs and in this way makes pregnancy possible. This is how the patient of polycystic ovary is treated in order to make her produce eggs. And it's important for a patient to reduce her weight not just for polycystic ovary, but even further at the time of pregnancy. It reduces the chances of having diabetes or high blood pressure during pregnancy. This is how weight loss can benefit the patient and so losing weight is important. Thank you.
अपॉइंटमेंटसाठी कॉल करा 99-22-432-972 किंवा भेट द्या www.ivfcare.in. आजच संपर्क साधा.